Okay, wonderful. We are back, and I want all of you to give Dr. Palmer a digital hand of applause while we are still on the air, as opposed to when we go off. This is a great presentation, and I'm going to bring Dr. Palmer back up. Dr. Palmer, I'll move your slides to the side. If you want me to bring them back up, I can, and you can, if you want to refer back to a slide in answering some of these. I saw some out here, and a couple points I want to question I made. But there's a question asked earlier about keeping mucus moving and how does one do that? And then a follow-up to that was a question about the lymphatic system. So how about this? You mentioned we should keep the mucus moving. What is there a process to that, or what is your recommendation?
So that a good way of doing that is the steam showers, humidified air. It helps to thin those secretions out. And once you thin those secretions out, they'll naturally drain. So I tell parents, and adults can do the same thing, of course. It's just that I'm a pediatrician, so I reference the kids a lot. But get into that shower. Don't get into the shower. Get into the bathroom. Get it steamy. Let that steam kind of break up that mucus and let it just drain out. With the kids also, we do nasal saline. In adults, you can do the nasal saline washes in the nose Frida, where for the children, the parent kind of sucks it out with the nose Frida to move the mucus so it's not just sitting in the pharynx and then the sinuses and then the nasal cavity.
In the adult population, we will start them on guaifenesin. I've used like a pure guaifenesin. Do you use that in the children's population? Are there some natural sources of guaifenesin, or is they all just over the counter?
We don't use that as much in children. And I think on one of those slides, it said echinacea and geranium as a source. But I mean, in pediatrics, we don't prescribe, we should not be prescribing that many cough medicines. We try to kind of support them with information when it's a common cold.
And personally, I've noticed that, and Dr. Floyd, I'd like you to chime in on this natural guaifenesin versus the over-the-counter stuff. And I've noticed that lemon, when I make a hot lemon juice or lime juice, it can serve as a mucolytic. I've had that experience personally. Is that either of your experience with using citrus in water, hot water as a mucolytic, or that? And that's one. And then the other part are the other natural mucolytics, either natural source of guaifenesin or other natural mucolytics other than guaifenesin that you know of for our audience.
I think. Yeah, I would agree with you on that. I mean, I think that's the kind of the bottom foundation of when we used to grow up and we used to make hot toddies, where it was basically lemon water. They would always add something like honey to it. But I think the honey benefit is basically an immune stimulant for some people, more so than having the benefit of the sugar. But yeah, the lemon has an astringent effect. Plus, I think just the citric has that mucolytic effect.
I typed in the chat Manuka honey. It's one that a lot of people recommend. I'm not sure if that's 1K or 2Ks, but either way, I use 1K, and you can add it if you need to. But okay, no, that's a good one.
Also, ginger. So honey, lemon, ginger, turmeric. Those things help. They're anti-inflammatory to the body, antiviral. Antibacterial, so those things will also help to thin the mucus. And I think if we stop doing some of the things that we're doing, it'll thin naturally because our body is clearing this stuff out. And when I say stop, I mean we stop the sugar, we stop the milk. Milk is going to make us thick. We stop the processed foods. We stop these things. I think that naturally it will thin itself. But if we keep doing, even though sometimes we just don't know, but if we keep doing those things, then it makes it harder.
I don't know. What's a metaphysics site? Somebody's asking about your metaphysics site.
I don't have a metaphysics site. Can they explain what that means?
It seems like we all need to get one, but anyway.
Maybe I need to get one.
But one other thing, let me get some other question. One other thing I'll mention too along those lines is simple hydration. I agree with you 100% about stopping things. And when somebody calls us have upper respiratory tract, I say go raw detox. I mean, you may not be raw your whole life or plant-based, but if you have one of the therapies go like a raw detox regimen, raw fruits, vegetables, like you said, you're removing all those mucus-forming foods. And then the other thing is that you're hydrating the body. And of course, those nutrients that you're talked about is also coming in the system. So a raw detox, as you implied, by removing bad stuff and consuming raw plant foods and hydration, drinking lots of water. Lymphatic system, is that, I mean, I guess you can do massages and mobilize lymphatics and help drain. I know with massages helps drain sinuses, and I know that's a mechanism. Anything else you can think of regarding lymphatic system?
You probably don't want to do this while you're sick, but you remember those little Zeppelins that we used to have?
Was that?
That people used to have back in like the 80s, 90s. The little trampolines that everybody used to have in their house.
Trampolines.
Yeah.
Some people still have it.
Those help the lymph system to dump and cleanse themselves.
Oh, that's right. That's rebounding. Yes.
Yeah. And also, when you're a child, we do these things more, but upside down. You know, the adults do it in the tables, the levitation tables, but you don't have to get that fancy. You could get upside down on your do the yoga move upside down, or you could probably lay on your bed and hang your head down upside down. Anything that kind of switches the level of the body will help to kind of dump the lymph nodes and clean out that system.
Let gravity help you out. You mentioned strep throat, and I wanted to make a comment and then raise a point. Strep throat. Well, there's several issues with strep throat. We deal with strep throat in the cardiology standpoint in terms of the long-term sequelae. So people get strep throat, and they can have long-term sequelae. They get heart disease and valve disease in particular, kidney disease, arthritis. And the point I want to make with that is that that's a well-known long-term sequelae of an infection. And a lot of people talking about, COVID, long COVID syndrome. But a lot of these infections, I've seen other upper respiratory tract infections have long syndrome. I had a patient come in with severe neurological problems and wasn't able to walk. I had to admit him to the hospital. We gave him steroids and everything. And his history was he had caught an upper respiratory tract infection from somebody in a movie theater. And we had to detox him. Now, steroids help, but we're really treating a long sequelae of an upper respiratory tract viral syndrome. And any of these viral syndromes can have a long sequelae where it's neurological or systemic inflammatory. And strep throat is well known, so I thought I'd throw that out since you went into strep throat. The other question I want to ask you regarding strep throat and other infections, how do we know? So I come in with a cough of upper respiratory tract infection, and I get my throat swab, and it's positive for strep. How do I know that strep positive test is due to a strep infection or strep colonization? And my infection may be due to something other than strep or any other viral, whether it could be influenza or whatever. I mean, I'm not going to mention COVID, but how do I know whether something, a positive test means it's infection? I can have symptoms, but I may have symptoms due to something else.
Yeah, I mean, that happens a lot. We don't know. And it's when that patient keeps coming in with strep after we treat them and they come back and they keep coming back that we say this must be a colonization, because you don't know just by the test if you have two things going on at the same time. Because one is a colonization in the background.
Yes. Okay. I mean, and that was the question came up when you mentioned that person had repeated episodes, and we're probably treating. And that's the thing and that's why I like these natural approaches. You let the immune system take care of things, because we will treat something specific, but we may be aiming a gun in the wrong direction, and you've got something over here, and we get a test that says, oh, this is positive, but it's not the true cause of the pathology or symptoms, but rather it's something positive on a test that's misleading us. And these natural things enhance your immune system, take care of whatever the problem is, which I think is important. There were other questions. Now, if y'all see questions there that I may have missed, let me know. But there was a question about copper with zinc. How do we determine how much copper with zinc? That was about Divine Life at 742.
Well, one thing about copper is that, you know, in your diet, if you're eating any mineral content food, you should get sufficient amount of copper. So if you, you know, they have a lot of external copper appliances, whether it's a copper clothing or copper material that has an enhancing effect. It's antiviral, actually, that will help. But as far as internally, you know, zinc is way to go. I don't think taking internal copper, because they do sell copper supplements, but I don't think it's effective that way.
But the external copper can be helpful as well.
Yeah, yes.
Now,
it has antiviral and antibacterial benefit.
What's the mechanism of with the external? This is how I get a copper bracelet. What's the mechanism of that?
Now, that's on the question. I've been trying to get to the bottom of that. But what I really think is that the positive ions that the copper is giving off tends to disrupts you know, the cell structure of viruses or affect bacterial replication growth.
Gotcha. So it doesn't have to be internalized. That's good. It can be limited by the body. Now, someone raised a question. I guess it could be controversial. I'm going to kind of address it. They asked about blood donation from vax to unvax. I'm not aware of any data regarding effects of blood donation from vax and unvax people. Now, vaccines have been around for a long time, and people get vaccinated for a lot of things, Hep B, et cetera. I'm just not aware of any data. I don't know if we've actually looked at, you know, I've got the hepatitis B vaccine, and I donate blood, and what effects going to have on somebody who hasn't gotten the hepatitis B vaccine? Are they protected? Are they, you know, harm? I'm not aware of any data. Are y'all aware of any data on any data on vaccinated blood donation from vax to unvax and vice versa?
Well, you know, actually, I heard an interview from I guess an employee at a blood bank, and they were talking about the people not donating, and it kept emphasizing to the public in their interview that the vaccinated, unvaccinated, doesn't affect your blood supply or is not transmitted that way, which I don't know. I didn't have a chance to look into more details or look for research data, but that was the position of the blood bank industry, that it's no effect, whether you're vaccinated or unvaccinated.
Now, did they support that statement with data or, you know, evidence?
No, and that's why I say I wanted to follow research to just check it out for myself, but I haven't done that yet. But I guess they were making that statement just based on the fact that I don't know if their supply was low or they had some specific data that said it's not a problem. You know, that could be another whole can of worms, a discussion for another day. Because I've heard other people come to the conclusion that you know, if people are vaccinated or unvaccinated and it gets into the blood supply, it can affect everybody and the ins and outs of that. But we'll save that.
Yeah, we don't have information on that. A lot of people throw a lot of theories around. I like to just look at evidence of things, but you know, it's one of those things. Seymour, thanks, Dr. Palmer. How about humming for increasing the production of nitric oxide in the sinuses that attack viruses? It also vibrates the sinus and keeps stuff moving. I understand the vibration part, the nitric oxide. I didn't know how does humming increase nitric oxide? That's an interesting question, actually.
I don't know about the nitric oxide part, but I would think humming, yes. Anything that vibrates and moves that. I mean, you know, in our cystic fibrosis patients, I remember doing chest PT where we physically are patting them before they got the jackets. We used to physically pat them. So any kind of manual movement is going to help to move that mucus. It seems like it's not doing a lot, but it does. And then, you know, humming or ohms. I don't know if that's what she's getting into. Ohming and having your tongue kind of connect with the top of your hard palate helps to vibrate that. And it does a lot of other things for the body too. So that always can be a good thing.
Fascinating. And then this is, can a person take too much zinc? Anybody?
And the answer is yes. I don't know. I know there is a upper dose of zinc because you can have a toxicity from taking too much. But I don't think the over-the-counter medications. I know 50 is kind of a higher dose. It's supposed to be effective against colds and flus. But I have to see what the upper limit would be,
It's water soluble. It's mostly gotten rid of through the renal function, right? Through the kidney.
Yeah, most minerals are, but it seems in my study there were some toxic levels of zinc, but it's pretty high. But I don't know what it is. So
yeah, it's a trace mineral. I mean, I think it's one of those that if you try really hard on any of these things, you can do too much of it. But if you stay very close to safe level, you should be in good shape. Somebody with renal failure, renal dysfunction, may have to be more alert to any mineral supplementation, because it's one of those things that, like you said, minerals are balanced by the kidney. So typically in the disease state is where you're going to really want to be alert to these things, more so than if you don't have any end organ failure or severe end organ dysfunction, particularly in this case, the kidney. But we've talked about supplements before, and we've did a series on it. We recommend that you get with a medical person or a healthcare practitioner who's experienced in using supplements and nutraceuticals, and someone who can also follow you clinically and make adjustments. Because as we always point out, and we point out in this show, Dr. Palmer pointed out so well, your food should be the first source of all your nutrients, your ideal natural plant-based diet. And then micronutrients should be targeted based on, say, disease states or seasonal disease risk, or in certain situations, your particular nutritional deficiencies, needs, or the like. And so I think it's important to keep these things in mind. And even though we're mentioning these supplements, I don't, and I think I speak for my colleagues, that we don't advocate just going to any store and pulling things off the shelf and taking them. Supplementation can potentially have benefit, but that can also be potential harm of taking supplements, especially the supplements have lots of preservatives and other chemicals that can be toxic to your system. So it's not an easy thing to just sort of pull something off the shelf and take it. I had one patient had a severe cardiac arrhythmia when he shortly after he had taken some herb or supplement off the counter. Had through a big embolus to an artery in the leg and the like. And so we're not sure if it's that supplement or not. We're not certain, but there's a very strong temporal relationship with the consumption of that and the onset of his condition. Now, he's doing a great job at, taking care of his diet and everything, but just one supplement of the wrong type can make a big difference. And so you want to make sure you're following up with a healthcare provider who, again, you can have an adverse reaction to any of the supplements, quality or none, but someone who can follow you carefully and make sure, A, you're getting the positive benefits from, or the hoped for or anticipated benefits from the supplements, and B, you're not, suffering any adverse effects from that supplement or micronutrient. So I just want to emphasize that. Any other, Dr. Atkins? Yes.
Yeah, I got the answer for zinc real quick. I had looked it up. But yeah, 30 to 50 milligrams of zinc is probably the recommended dosage for its use as far as fighting flus and viruses. One thing it noted that, when people eat oysters, eating 3 ounces of oysters give you about 85 milligrams of zinc. And some people go in oysters and they do oyster binge, so you can't get a lot of it without having a problem. If you have 3 ounces of oysters and some people eat a half a pound of oysters, they're getting almost 300 or 400 milligrams of zinc, because that's the food with the highest level of zinc in it. So it doesn't seem to kill you, but the recommended dosage is 40 to 50 milligrams as an average dose, and I think that's good for cold and flu season.
Yeah, oysters have other ways. Oyster consumption have other ways of killing you other than the zinc, I bet.
We don't talk about parasites and bacteria and and the rest of the stuff in the ocean, the PCBs.
Yeah, you go on. I've been putting my kids through college on oyster consumption. Jennifer Fisher asked about, does anyone have an opinion on apple cider vinegar as a treatment? Apple cider vinegar is mineral rich, is it?
Yes, well, the alkalizing effect of apple cider vinegar is what's the positive thing, and it stimulates the immune system. But yeah, that's it's something that you could do. Lemon juice, alkalinity, the apple cider vinegar. What we recommend is doing at least 2 tablespoons and 8 ounces of water. Be sure to do an adequate amount of water, because if you just do it straight every day, it can have a effect on your teeth. But yeah, just diluting the water 2 ounces. But it's the alkalizing benefit that it helps enhance immunity.
Wonderful, wonderful. Well, as usual, I learned a lot tonight, and thank you very much, Dr. Palmer. We're going to give you the last word of this session to help us close out. What are your final comments to our audience and to anybody who may be listening now or later?
Well, thank you all for listening, but just want to kind of give us a background and a foundation to step out into the world with and feel confident that, okay, if I catch anything, that I know what to do with my body and how to help my body to recover quickly, and not go down into a spiral of, well, what's about to happen next? That's why I feel like people feel lost about what's about to happen next. And if we regain and we live our life with intention and we're doing things intentionally, I'm eating this because I'm going to empower my day, or I'm doing this, I'm exercising because I'm going to empower my life, and thinking in that sense instead of reacting, being a reactionary type person. So I just want us to ourselves do that for ourselves, but again, do that for our children, because they're being born into a whole new society. So we have to equip them differently than we were equipped. And it's time for us to start taking the action and show them the way.
Wonderful, wonderful. Well stated, well stated. I will see you guys backstage, and I'll close out. Thank you very much again, Dr. Atkins, Dr. Palmer. And thank you guys for supporting the channel and listening. And if you haven't already, hit the thumbs up, give us a like. And of course, if you haven't subscribed to the channel, please do so, especially if you like this content. We give you this type of content on a regular basis. You'll have access to other content we produced in the past and also future content. And of course, share this information with friends, loved ones, colleagues, and anyone you think would benefit from this. Illness has become the norm in our society, and that's something that, is a real problem. As Dr. Palmer pointed out, just colds has a major economic impact on our economy, and it's something that is very simply treated, number one, but more importantly, is simply prevented, as Dr. Palmer mentioned in her closing comments, that by simply doing the right things to take care of your health, with exercise, proper nutrition, even before the onset of a common cold, or upper respiratory tract infection of any other type, you can actually ward it off. Or you can enhance your innate immune system to the point that you don't get severe buildup of mucus and severe symptoms, but rather just very mild symptoms to the point that you barely notice that you've been invaded, because your immune system takes care of it right away and gets rid of it. So really, optimal health and overall well-being should be a proactive thing, not a reactionary thing, as she pointed out. And so I hope all of you take that to heart. Again, give us a thumbs up, like it if you like it. Please subscribe if you haven't done so. And of course, share this with anybody that you know, especially if they can benefit from this information. Until next time, keep it fresh, natural, and live.